Hi, I'm Kaoruko Seino from Tokyo Medical and Dental University and WHO Collaborating Center for Healthy Cities and Urban Policy. So this is a study to understand how is a no-do, thank you, what is a no-do gaps for the prevention of heat-related illness and what are the context or related with that gaps. Next. Does it work now? Okay. Um, here, okay, so this is in the gaps. So nobody doubts the high temperature and humidity and high radiation heat is related with heat stroke. And people know from the ancient time, so how it occurred. But so still we are losing thousands of people each summer. So why this happened is because there is a obviously know the gaps for the prevention. And you will see right side. So these are steps of the implementation research. And we are now in the third and fourth steps, right? Effectiveness and efficacy. We do know risk factors and preventive measures, but that is not implemented to the right target and right time in the right way. So this is a study to see about this to understand how it is happening. Next, please. So this is the risk factors, and these each factors are correlated each other, as we do see in social determinants of health for not only for heat stress but for every diseases. So here, in this study, we examined the individual characteristics and social isolation and preventive measures for heat stroke. And here, in the box, community property. So this is a study from one community, so we cannot compare. But here, community property, we take that as a context of healthy city. So healthy city is the one advocated from WHO 90, very end of 1980. So from 1990. So for this program, we consider the community property. Next, please. So I already talked about personal preventive practices. We examined these two association. How we did is in the gray box. So we sent our questionnaire to the elderly in a city located in central zone of Japanese main island. And the variables included in the items included in the questionnaire are in the bottom, heat coping practices, source of information, seeking information, and interaction with family, friends, and relatives. And we also asked about community activity involvement. So what kind of community activity you would see here? So they're very active. Owari Asahi City is very active for the involvement of elderly resident for, they call it early muscle training to prevent frailty and for other activities shown here. So this is the concept that Owari Asahi City applies. Next, please. So this is the result. You will see three slides from here. So you have seen male and female adapt differently for the differently to prevent heat stress disease. So we have seen the three in the right box: air conditioning use at nighttime and checking the room temperature frequently and use of ice packs on their body. So these three were associated with the occurrence of heat-related illness during the summer. Next. So when we see the association with the occurrence of heat-related illness and their interaction with friends, so living around or with family, with friends, neighbors, and interaction. So we didn't include the engagement in the community, like exercise plan, but in independently, but we do include it in the item of the interaction with neighbors. So for the male, if they live with family or have an interaction with friends or relatives, so they acted differently. So that was significant. But for female, only the interaction with friend uh, affected the so only female who did not have interaction with relatives, they did not they have more likely to have heat related disorder during the summer. So as I have shown in the previous slide, we use the outcome for if the elderly people adopt three of the preventive measures, like checking the room temperature and using the ice pack and air conditioner use during the nighttime. So if they are not applying one of these, or they have applied one of these preventive measures, so we did examine its association with living alone or connection with their neighbors and relatives and friends. So as you have seen here, um, uh, only the connection from a connection with relatives and friends that were significantly associated with the applying the relevant preventive practices. And we do see the trend, but other two were not significantly associated. Hold the mic. So next slide is the last one already. So this is summary of the study. So heat coping practices were underused amongst the elderly who did not have our connection with relatives or friends. And so the setting where the city that applies healthy city approach advocated by WHO understands the use of heat coping practices amongst the vulnerable population. Here, vulnerable population means disconnected from the community. So they are kind of target to shape the public health intervention. And so what steps we are now is we are under developing the intervention program to implement in different community settings. Thank you.